Hi, my name is Tara Arora, and today I will be presenting to you my policy, which is the Affordable Care Act, also known as the ACA. So, first, for a little bit of background information, the Affordable Care Act was officially signed into law in the United States in the year 2010, and this is when President Barack Obama was the president at the time. And so the Affordable Care Act is also known as Obamacare, but that's the informal or colloquial version of it. And basically, the ACA was a landmark effort to completely reform the US healthcare system because at the time, the US desperately needed it, even though at the moment there's a lot of things that can be done to majorly improve US healthcare. In the year 2010, this really, in prior to this year, there were a lot of things that needed to be done so that it would be more fair and affordable to everyone and not just people of a higher class or higher socioeconomic status. But, anyways, more on that note, some of the objectives of the Affordable Care Act included enhancing accessibility, control costs, and just improving the overall healthcare quality in the United States. So, with that, some of the key provisions of the ACA included the expansion of Medicaid eligibility for low income individuals and families because they were the ones that needed this the most and were basically in a position where they were having to choose between putting food on the table and getting the health care that they so deservedly needed. And then another key provision was the establishment of health insurance marketplaces for private insurance plans, and this was completely new. None of these four provisions existed before the ACA, and now these all became basically a law. And another key provision that I thought was notable to mention was that the prohibition of insurance companies denying coverage based on pre-existing conditions. Like I said before, these were not things that were there before, and now we might be accustomed to these provisions or used to them, but before this time, these affected low-income families and individuals a lot, and so these were things that were basically needing to be done in our country to make a healthcare a lot more affordable and accessible to everyone. The last provision that I thought was notable to include was that children are now allowed to stay on parents' insurance plans until the age of 26, and before this was different as well. So, some more key information that I pulled from all of the sources that I've researched were that there were certain preventative measures that the ACA followed and that the ACA kind of had in mind when these programs were being implemented. So, first off, the implementation of preventative health measures. As I just explained, healthcare already is expensive enough as it is, but it wasn't fair that it was basically to the point where people were having to choose between getting their loved ones the help that they needed or putting food on the table. And so those are things that no one should really have to go through. And so the ACA was really striving to completely reform all of these policies. And then another preventative measure that the ACA held was the establishment of Center for Medicare and Medicaid Innovation for new payment models. Now, in terms of the cost control mechanisms, the Affordable Care Act had the creation of accountable care organizations, and these are also known as ACOs. And they also had the introduction of value based purchasing initiatives, both of which really did not have much of a presence before the ACA. And now, in terms of the key focus areas that I thought were important, which I saw across any article or source that I was looking at, was the promotion of primary care and care coordination, in addition to the investment in health information technology, because before both of these were pretty weak in the US and, again, not accessible and affordable to those who often needed it the most just because they did not belong to the same socioeconomic class that would be able to actually afford it. Now, after learning more about the Affordable Care Act, I realized that it's kind of divided up our country based on the politics and social positions and stances that everyone fits under. And so I realized that there's quite a few, the population is pretty much split into those that are proponents or supporting the ACA and those that are completely opposing it. And so to begin, we'll be starting with the opposing perspective of the ACA. So, overall, the key points that I seem to see across all sources on the opposing front was that the people that were against the Affordable Care Act and that are still against it, they have concerns about the ACA's financial implications because although it is striving to make healthcare more affordable for all, the financial implications and downsides are still there and still affecting our economy. It's just in a different way. So it might not, or this is according to what the opposers opposing perspective is saying is that basically, like, although it seems upfront that it's more affordable, more beneficial, more fair to everyone, like lower costs, it's not actually quite like that because our economy is still getting affected and having negative financial implications. It's just in a different way. So the critics are arguing that there's now increased premiums, opposition towards individual mandates, and a burden on small businesses, which is financial burdens. So all of these ways basically are like a different way that the financial implications are affecting our economy, even though it was in a different manner before. The opposing perspective also says that healthcare providers and insurance companies now face the administrative burden and financial strains, which is why a lot of articles I was reading, sometimes the titles would even say, like, why Obamacare ruined my practice. And that applies to a lot of healthcare and like doctors, basically anyone that's working in the healthcare industry. From a lot of the articles, seems to be pretty against Obamacare because they feel that it's actually affected their practice and the administrative burdens, and a lot of those aspects for them have now become a hassle that potentially were not as bad before the introduction of the Affordable Care Act. And so now for the supporting perspective, which is those who are in support of Obamacare and the Affordable Care Act, they feel that it emphasizes the contributions to expanding healthcare coverage, which is what the ACA was sought out to do to begin with. That's what the entire goal was, basically to make healthcare more affordable and fair for all. And so they have, from the articles and journals that I've been reading, it does seem like there has been definitely like positives and improvements on those notes, even though there are negative financial implications. Like what the ACA sought out to do, it does seem that they are currently achieving and have been achieving. And so the supporting perspective also says that the Affordable Health Care Act highlights the successes of Medicaid expansion, health care insurance marketplaces, and the elimination of discriminatory practices. And that, I think, is so important. Personally, I think that eliminating these discriminatory practices was always necessary in our country. So even if that sort of came at the cost of more financial implications on other sides, I think that those discriminatory practices needed to be eliminated to start with. But that's my personal opinion because I think I would be more on the supporting perspective. And then what some of the other supporting perspectives say from the articles are that the positive outcomes are really starting to show in terms of preventative care and overall healthcare quality. And obviously, I don't mean to sound biased, but I just feel like if that is what the ACA was striving to do from the start, then even though there are like hassles with the administrative burdens and like the financial implications and the premiums, but the goal was to make healthcare more affordable and accessible for the lower income individuals and families. And so I'm very happy to hear that they have been making progress on doing so, because that's what their goal was and what they aimed to do to start with back in 2010 when they first launched it into being a law. So now, when relating the Affordable Care Act to the NASW Code of Ethics, there are more, but I just mentioned the key 5 that I felt related the most to Obamacare and the ACA. So I didn't list out how they related to every single type of code of ethics, because I believe service was the 6th NASW Code of Ethics, but I felt service didn't tie in quite as well as these other 5 did to the Affordable Care Act. So now, to begin, the first principle of the NASW Code of Ethics is social justice, and I feel that this relates to Obamacare because it's reducing disparities in healthcare access that were once so prevalent. And even though these disparities are very much still there, don't get me wrong, I do feel that it's lessened a lot based on the research and articles that I've been reading. For the second principle of the NASW Code of Ethics, this is the dignity and worth of the person. And I feel that this ties in perfectly to the Affordable Care Act because it strives to have quality health care for all and prohibition of discrimination. So this obviously shows and stresses how important the dignity and worth of every single person, regardless of socioeconomic status, is. And the Affordable Care Act is very much making that a reality. And for the third principle, which is the importance of human relationships, this shows a major emphasis on patient-centered care and care coordination. And to me, that really does show the importance of human relationships, because this patient-centered, patient-focused, like individualized care would not be possible without this principle tying into it and without that being such an important factor of the Affordable Care Act. Next, for the fourth principle, which is integrity, I feel that this relates to the Affordable Care Act because Obamacare measures to control healthcare costs and enhance transparency. And even though there are things that can be done to make it even more transparent, I do feel like it's a lot better than it was about over a decade ago, back when Obamacare was not a thing yet, because a lot of the healthcare policies and things that were going on were very much behind the scenes, and customers and clients didn't really know as much of what they were being billed for, and there just really was not as much transparency as there is now. And even though healthcare costs have been expensive and always will be expensive to some extent, it's become a lot more controlled than it once was. And so I feel like integrity really does tie into that, because if you compare these statistics to over a decade ago, it's very much prevalent and very obvious. Next, for the fifth principle, which I felt related really well to the Affordable Care Act, was competence, because the Affordable Care Act focuses on preventative care, primarily like healthcare and primary care, as well as evidence-based practices. So I feel like this really does stress the level of competence that's needed.
Attention patrons of Armstrong Student Center. The time is 11:45 and we will be
Next, in terms of
15
challenges
minutes.
and questions raised, and these were the challenges and questions raised based on all of the articles and journals that I was reading. I felt that some of the main concerns and things that are still continuing to be debated and questioned are the opponents' concerns about personal freedom and autonomy. Another question or category that kept being discussed throughout all the articles was the complexity of the law posing challenges for practitioners. And this is, like I was saying, those articles that were saying that the healthcare practitioners, doctors, nurses were sort of anti-Obamacare, saying that it was making their jobs a lot more difficult. That's sort of where that ties in. And another challenge or question that I feel was brought up throughout the articles was the urgent need for continuous evaluation and refinement, because I do think that there's been a lot of positives and benefits to Obamacare, but obviously there's room for continuous improvement and things that can still be worked on, especially like the challenges for the healthcare practitioners, because a lot of their job seems to be made a little bit more difficult now because of the Affordable Health Care Act. But I do think that it still needs to be in place to make healthcare accessible and affordable for everyone of all socioeconomic groups. But I do think that there's things that can always be done to make it better and even more improved for everyone involved. And now, to sort of tie and everything together and conclude, there's still an ongoing debate, as you could see, and that really does reflect the complex nature of healthcare policy, because there, in my opinion, there will never really ever be everyone on completely one end of it, because it is a healthcare policy, and healthcare policies, like across the years and across the world, have always had very strong opponents and supporters. And so I think that healthcare policy in general is just a very multiplex sort of policy to even be dealing with, and no one is ever going to be on the exact same page, because we all have different things that we find to be valuable in terms of our politics and our socioeconomic thoughts and ideas. And so it's hard to get everyone on the exact same page, but it's just a very complicated idea to even throw out and have a law with in the first place. But it's just a good thing that it is in place. There's just things that can be done to make it better so that it's not as much of a heated debate as it still currently is. Next, the alignment with the NASW principles, as I just mentioned, raise questions also related to the autonomy and competence. And we were discussing that a little bit earlier, but that's still a question that is being asked. And then the proponents really do commend the efforts, while the opponents criticize the economic impact and and potential infringements. And so, like I said, it's hard to get everyone on exactly the same page, because even though obviously there's so many benefits to the Affordable Care Act, the burden of the financial implications and the economic implications are obviously affecting people that are not as maybe well off, or like people that are working in the healthcare industry and maybe feel like they're getting the grunt of it all. And so I feel like that's still a heated debate that's going on, and the proponents and opponents have such like different viewpoints on these that it's hard to find a policy or find things that would work for everyone equally, because for it to be more fair to everyone in the country, obviously that's going to come at a cost. And so there are financial implications on other sides that are affecting people that are working in those fields, but that's definitely a little bit difficult to avoid. So those are things that are being worked on currently. So it's a more fair playground for everyone. And then also to conclude, the Affordable Care Act really does emphasize the need for continuous evaluation and refinement in healthcare policy. I did just mention those, but those are just concluding points to know that these are things that are being worked on and that are continuing to improve as we go forward. But it's not been perfected yet. It's very important that the Affordable Care Act is even in place at all, so that now the positives are affecting the groups that it was sought to help in the first place. So I think that there's just things that need to be tweaked to make it less of a heated debate between the two sides. Now, hopefully, after hearing me discuss all of these viewpoints about Medicare, Medicaid, the Affordable Care Act, how that ties into the Code of Ethics, like hopefully there's some things that now make more sense or that you were able to learn from this presentation. And so I wanted to now ask you, the audience member, a couple of discussion questions, with my first discussion question being the following. In the light of the ACA's emphasis on preventative care and the creation of accountable care organizations, which are also known as ACOs, how do you think these measures have influenced the dynamics between healthcare providers, insurers, and patients? Consider both the positive aspects, such as improved coordination and focus on outcomes, and potential challenges, such as increased administrative burden or financial strains. Additionally, how might these changes align with or diverge from the ethical principles of social work, particularly in promoting the dignity and worth of individuals within the healthcare system? So, those are points that I gave my opinion on. And so now I'm curious to see what your thoughts are, because we might not even be on the same page for that at all, because everyone is relating these healthcare policies and burdens to what affects them the most. So I'm curious to hear what you guys think on this first discussion question. And now for my second discussion question is the following. The ACA's impact on small businesses and potential job losses has been a point of contention. How do you think the economic implications of the ACA should be balanced with the broader goals of expanding healthcare coverage and promoting social justice for all? In your opinion, are there alternative policy approaches that could better address these concerns of opponents while still achieving the overarching goals of healthcare reform? How might social workers advocate for policies that strike a balance between economic considerations and ethical imperatives within the healthcare sector? Because I'm curious to know what you think would be sort of like a level playing field between the two, because obviously the financial implications are very important, but I also feel that the ethical implications and the actual healthcare for all is very important. So it's hard to see what a middle ground would be, but I'm really curious to know what you guys would think for this. But thank you so much for watching. I hope you were able to learn something and got to know more in detail about what Obamacare is, because I feel like I had always heard about it and I knew bits and pieces, but I never really understood it to the extent that I do now. But I hope you learned something, and hopefully those discussion questions will be easy to answer after watching my presentation. But thank you so much.